113 confirmed cases of COVID-19 with 25 recoveries. Joining me on the line is the Minister of Health, Dr. Kalumbi Shangula, to give an update. Good afternoon, Dr. Shangula.
Good afternoon.
Doctor, where does Namibia stand today regarding COVID-19?
Yes, thank you very much. And I would like to present the COVID-19 today. Good afternoon, fellow Namibians. We have recorded 72 new COVID-19 cases. 71 are Namibians and 1 is a South African national. 68 are from Walvis Bay, 1 from Swakopmund in Erango region, 1 from Engera in Hangwena region, 1 from Keetmanshoop in Karas region, and 1 from Mashakati in the Oshana region. 41 are males and 31 are females. The youngest one is 1 year old, and the oldest one is 58 years old. They are all clinically stable. Contact tracing is ongoing. The 1 case reported from Keetmanshoop is a South African female cross-border truck driver who traveled from Cape Town on the 8th of July 2020 and arrived in Namibia through North Uga border post on the same day. She was screened at Keetmanshoop Gronau B1 roadblock and proceeded to Oranienburg to offload at Nam Depot. She drove straight through, did not get off the truck at point of offload, and returned on the 10th July 2020 from Oranienburg. A specimen was collected from her at Keetmanshoop Gronau B1 roadblock on the 10th of July 2020. She had no COVID-19 related symptoms. She left Namibia on the 11th of July 2020 at 8 o'clock in the morning through North Uven Point back to South Africa. The result came out last night positive. The one in Oshakati traveled from Walvis Bay on the 22nd of June 2020 and got quarantined in Oshakati. A specimen was collected on the 3rd July 2020. No COVID-19 related symptoms were detected by then. The one from Engera was visited by an acquaintance from Walvis Bay in June 2020, who went back on the 17th of June 2020. At that time, he had no symptoms consistent with COVID-19. However, upon return, he developed COVID-19 symptoms, was tested, and the result came out positive. He informed the persons he visited about his result. She then reported herself at the health facility on the 1st of July 2020, was tested and advised to self-quarantine till the result are received, since she was already beyond 14 days. She did not have symptoms consistent with COVID-19. We have recorded 1 recovery. That is case number 17 from Keetmanshoop. A total of 1,024 results were received, of which 861 are from NIP and 163 from PathCare. Out of the NIP results, 44 first-time tested positive, while 85 known cases tested positive again. 11 known cases tested negative for the first time, while 1 has recorded a second negative. That is the one I announced as health recovered. Of the 163 results from PathCare, 28 first time tested positive. The overall result is as follows. The overall situation is as follows. We have now 785 confirmed cases, and the new one are 72. The number of recoveries is still now at 26. We have 758 active cases. We have 1 death, which I announced on the 10th of July, And total samples tested so far is 13,999. Active contacts are 1,142. The cumulative number of people in quarantine stands at 4,420. And number of quarantine discharged are 3,661. The number of people in quarantine are now 759. On the 10th of July 2020, I announced the first death due to COVID-19 in Namibia. A death due to COVID-19 is defined as a death resulting from a clinically compatible illness in a probable or confirmed COVID-19 case. There should be no period of complete recovery from COVID-19 between illness and death. A death due to COVID-19 may not be attributed to another disease, for example, cancer, and should be counted independently of pre-existing condition. A person who died due to COVID-19 is buried by the state and not by the family. This concludes today's update, and I thank you.
Thank you so much, Doctor, for that update. Well, that was Dr. Kalumbi Shangula, the Minister of Health, giving us the update of COVID-19 within the country. Now, in other